Hi, my name is Eva Grayzel, and I'm a survivor of stage 4 tongue cancer. It all started with a sore on the left side of my tongue, an unusual place for what seemed like an ordinary canker sore. But after 8 weeks, I went to a local oral surgeon. He examined the ulcer. I complained of the pain. He said, if it bothers you so much, we can take it off. He said, great, take it off. 2 days later, I was fine. 2 weeks later, his receptionist told me my biopsy was negative. I said, excuse me, are you calling the right patient? She asked me if I had tissue removed from my tongue, and I said yes, but I had no idea it was being biopsied. It turned out that it was read by a general pathologist who missed the subtle changes of precancer. In fact, my biopsy wasn't hyperkeratosis. I found out 2.5 years later, when I was finally diagnosed at stage 4, that it was moderate dysplasia at that time. Imagine that. If it had been read by an oral or head and neck pathologist, I may never have developed into cancer or progressed to stage 4. Well, for 2 years after that biopsy, I was fine. I didn't notice anything. However, the tissue was changing. The color and the texture was changing. But I wasn't educated or told to look at that area. My doctors had no sense of alarm that it was changing a little bit because I was young. I never smoked. I rarely drank. Well, 2 years go by and a sore returns right over the biopsy site. I went back to the oral surgeon 8 weeks later. He looked at my report and he said, you have hyperkeratosis. It's nothing to worry about. It's caused by trauma. And he gave me rinses and gels. I followed doctor's orders. Another 8 weeks go by. I go back to him. He says, Eva, this has to be caused by trauma. Your teeth are sharp. Go to the dentist and have them shaved down. I follow doctor's orders. Another 8 weeks go by. I go to a different oral surgeon in that practice to see if maybe he would have a different opinion. He looked at me and he said, Eva, maybe you talk too much. No, really, he said that. Okay. I said, well, why isn't it going away? And he said, it's caused by trauma. I want you to have a night guard made to protect your tongue from your teeth. I did that. 2 weeks until the impressions came back. I wore this night guard 24/7. There were days when I thought the lesion was a little bit smaller. There were days it didn't hurt so much. But every single doctor said to me, if it doesn't improve, come back. I hope that if you take one thing out of my story today, that you never say that to a patient. If you say, if it doesn't improve, come back, you're asking the patient to self-diagnose themselves. I learned that a biopsy is not 100% definitive. They can take the wrong tissue, they can mishandle the tissue, and they can misread the tissue. So if your patient continues to complain about an issue, question the biopsy. So finally, I had so much problem eating, talking, sleeping from the pain. I finally went back to the oral surgeon and said, we have to do something. He said, let's schedule another biopsy. And I got this great idea to finally call someone at a big medical center. It took 3 weeks to get in to see this doctor in New York City. Best decision I made in my life, as you can see and hear. Dr. Erkin looked at me and he said, who are you here with? We're going to do a minimally invasive procedure today. He told me afterwards that I was stage 4 squamous cell carcinoma. I never knew you could get cancer in the mouth. If any of my dental professionals had educated me, if that receptionist had said, your biopsy is negative for cancer, if anybody used the words, I would have known that it was a remote possibility, and I believe I would have been more proactive. I had 1/3 of my tongue reconstructed from tissue on my forearm and tissue from my leg. I had a radical neck dissection. So I have a big scar here, and they took the entire sternocleidomastoid muscle because lymph nodes cling to the muscle, and they had to take the whole muscle. I also have these grafts on my leg because they took fascia from my leg to rebuild the density in my tongue. Yes, it's an extraordinary story. And now I'm a 27-year survivor. I speak normally, I eat normally, I don't taste or feel on the left side. But they left the tip of my tongue intact, and this enables me to articulate my speech. I appreciate that you listened to my story today, and I hope and pray that hearing my story will raise the bar on your dedication to educate patients about oral cancer and do a thorough oral cancer screening. If you could save just one life in your entire career in dentistry by doing screenings on all of your patients, wouldn't it be worth it?